Okay?
Okay.
So I'm here with Dawn, and Dawn's the model because we're going to use this for everybody from now on. Do you consent to be a model for everybody else when we do this?
Absolutely.
Thank you very much. So Dawn and I are doing the 3 muscle releases, and actually the 3 muscle releases on each side, to be able to determine. All right, that's good. All right, good.
There we go.
So here with Dawn, and we're going to do the typical muscle releases that we do in our office in order to be able to get rid of pain and help people to open a little bit better. There are 3 different muscles, and we'll go over them one at a time. The first one is going to be the external pterygoid release. And the external pterygoid release, which is all of these are near the upper arch. You're going to slide your finger along the buccal or the outside surfaces of the teeth until you reach a notch right behind. And then you're going to push up, and then you're going to push in, and you should feel discomfort. Dawn, you feel discomfort there? All right, good. So now, Dawn, I want you to do that yourself. So do that with your little finger. You want the baby finger of the opposite hand. So notice she's using her left finger, her left little finger, sliding along the sides of the teeth, going up until you reach a notch. You feel that notch? And then push in and make sure you can get the same kind of pain that I got. Yeah? Okay. And so now you want to push until you feel that muscle release. And as your fingers get more used to feeling that, you'll actually feel it give a little bit. It's kind of interesting. If it doesn't give right away, hold it for 30 seconds. You're not going to get any more out of this than 30 seconds anyway. How you doing?
Oh, it's tender.
Yeah. All right, so the next one we're going to do is going to be the temporal tendon release. There's a temporalis muscle that goes along the side of the head, goes under the cheekbone, and inserts on the mandible. And what we're going to do is go into the area where it inserts in the mandible and release it from that position. You can also massage the muscles on the top along the temporalis as well. That would be a separate exercise. We're just going to release it from the inside. So in this, what we're going to do is place the finger, and your finger is going to go out this way. So for the right side, you're using the same hand, the right hand, to go on the right side. So what we're going to do is slide the finger along the top surfaces of the lower teeth, and you'll feel that there is an ascending ramus. It actually goes up, and it'll go to a point, and once you reach the point, you'll feel an ouch, and then you feel the ouch, and then you'll push outward towards the ear. Again, you'll hold that for about 30 seconds. So try that and see how that works for you. I would use the little finger for everything. Okay, so now you're going along the tops of the teeth. You go up the ascending ramus, then you're going to feel a point, and then you're going to push out. Yeah. All right, so you hold that for about 30 seconds. You don't have to hold it for 30 seconds now. I've already beaten you up a couple times with this. Right?
That's tender.
All right, good. Now, the third release is the internal pterygoid release. And the internal pterygoid is actually the muscle that forms the front portion of the throat. It's actually in front of where the tonsils are. What you're going to do is to go along the top surface of the lower teeth and go inside between the tongue and the throat, and you'll feel that first muscle band, which goes vertically, goes up and down. You're going to push in, you're going to go in, and then you're going to push out, and you'll feel the discomfort there. Okay? Again, you'll hold it for about 30 seconds. So give that a try.
That is tight.
Yeah. Now, what you're going to do is, that's also, you're using the same hand,
Okay, and the
or the
pinky.
hand on the same side, the pinky. Go back towards the throat until you feel that band, that vertical band of tissue, and see if you get the same feeling. How's that? Did you find it? Yeah, good.
It's very tight.
Good. So now you do the same thing on the left side as you did on the right side. So it's the same 3 muscles, and you use the correct finger for the temporal tendon release on the left side. You're going to use the left hand. For the internal pterygoid, you're going to use the left hand, and for the external pterygoid, you're going to use the right hand, and you're going to push in. And with that, you got it. Now, Dawn began today, this is only the first time she's doing it, she began at a vertical opening, an interincisal opening of 34 millimeters. By the time we got done with these 6 muscle releases, the 3 on the right side and 3 on the left side. We're able to get to 39, almost 40, without straining. So keep on doing this. The goal is to get open to 48. 48, I mean, it varies a little bit. If you're looking for a firm number, you're looking at 48 millimeters between the lower incisal ledges and the upper incisal ledges. You got that, you're doing your own self-massage and putting somebody like Dawn, who's a physical therapist, right out of business. So, hope you enjoyed this. If you have any questions, just contact us.